There's some weird and honestly almost unbelievable conditions dogs can develop. So today we're going to look at 7 of them. And this way you can learn what to look for and what to do in case you ever see your dog displaying any of these behaviors. The first one we're going to talk about is something called Canine Alien Hand Syndrome. That's right, aliens. Woo! So this is a condition where the dog's body and their limbs appear to kind of move on their own, almost like they're being controlled by like an alien hand. It's basically a neurological condition that affects the dog's motor control and coordination. The name of the syndrome comes from the human version. There's actually something called human alien hand syndrome. And for humans, it's the same thing. It's characterized by a human's hands kind of just unconsciously moving on their own. Dogs with this syndrome will display involuntary or what looks like purposeless movements with one or more of their limbs. And you'll see a shift in your dog's personality when this happens, where they'll become frustrated or confused actually, because they don't understand what's going on. Why is my leg moving? Why is my other leg moving? I'm not controlling this. Now we don't know what causes this exactly, but the belief is it has something to do with disruptions in the brain's motor pathways and connections. It's really important that we separate though whether the dog actually has canine alien hand syndrome or some other condition that could be causing weird movements. There are other neurological reasons that can cause kind of weird movements in dogs, also physical issues, things like hip dysplasia, arthritis, stuff like that. So making sure that we differentiate this syndrome from other issues, super important. Now there's no magic cure for this, unfortunately. We can't just do brain surgery on the dog and make it go away, but there are some potential medications that dogs can be given to help reduce kind of the symptoms or the secondary effects. Pica syndrome refers to a condition where dogs are eating objects that have no nutritional value to them, and it's just a compulsive behavior to want to eat basically inanimate objects. You'll see dogs with pica eating things like rocks, underwear, socks, anything you leave around, paper towels, anything that the dog can get in their mouth, they try to chew it up and swallow it. Now there are just some straight up behavioral reasons why dogs do this, whether they're just bored or anxious, but there also are medical reasons why dogs do this, and sometimes it can be due to a nutritional deficiency. The dog's not getting enough nutrients in their food. They're just trying to figure out, what do I need to eat to feel better? And they start eating things because in the dog's mind, they go, oh, maybe if I eat these rocks, that'll give me more whatever, calcium. Maybe if I eat this underwear, that'll give me more protein. When dogs eat objects that cannot be digested and broken down in their stomach, often what happens is it either gets stuck in the stomach or it gets stuck in the intestine. How? And then that creates a blockage, right? If it's stuck in the stomach, the dog can throw it up. And then, okay, we're good, stuff can pass again. But if it gets into the intestine, the only way that it can get out is either they gotta hopefully poop it out or they have to do surgery, which is very expensive, it's very painful for the dog, it is a big deal. And if we don't do surgery and it doesn't pass, unfortunately, the dog can actually die. So when a dog starts eating random objects, we need to rule out, is there a medical issue going on that's causing this, or is it strictly a behavioral issue? So the first thing you wanna do is make sure we make an appointment with the vet and see if they can run some diagnostics, do the blood tests, maybe they need to do x-rays, and see if there's something that comes up that can suggest, hey, there's a medical reason why our dog is eating these things. And if that happens to be all cleared, then we can treat this simply as a behavioral problem. One of the things I like to do with dogs that have pica is really using lots of bitter sprays. So let's say the dog always wants to eat socks. We take socks and we dip those socks and we soak them in bitter spray. It tastes so awful. And then we leave them all over the ground. Dog goes over to grab the sock and they start chewing and oh my God, this tastes disgusting. It's all sour and gross. They spit it out. They go to the next sock. Oh my God, this one's even worse. And the dog starts to see, hey, whatever this thing was that I used to love to eat, this is really not pleasant anymore. The next condition we're gonna talk about is polydactyly, which is basically limb duplication in dogs. This condition is very similar to the same condition humans experience, where they grow extra body parts. And with dogs, what will often happen is the most common thing is you'll see them have extra toes, but occasionally they can even have extra limbs, extra legs sticking out here, another leg sticking out here. You can get all of these kind of weird mutations. An interesting thing about this is there's actually certain breeds that are much more prone to this. American Water Spaniels, Newfoundlands, Great Pyrenees. When you see like dog shows, right, like Westminster Dog Show or any kind of dog show, there's very specific breed standards that the dogs have to follow and that the judges are looking for. And funny enough, it actually specifies for these breeds how many toes they're allowed to have. And if they have too many toes, they get disqualified. Disqualified! When dogs are born with those extra limbs or extra toes, it's interesting to note that those extra toes aren't always functional. Sometimes there's actually no bone there. It's just the tissue. Sometimes when that's the case then, and your dog has that extra toe but can't actually support it, it can cause mobility issues. As far as diagnosing it, it's very easy because, I mean, you're looking at a dog, he's got 6 toes, right? Or he's got an extra leg sticking out somewhere. That part's pretty self-explanatory. It's pretty easy to figure out. The condition of those extra toes, though, or extra limbs, that's where we need a little bit more diagnostic tools where we can do either x-rays, MRIs, something like that to figure out, kind of look at the bone structure, see what's actually going on. Depending on where the extra limb's growing out of or how the toe's affected, sometimes you do need surgical intervention. My opinion on taking care of dogs is always to put the dog's needs first. Whatever is best for the dog and is going to allow them to live the most comfortable life is what we should do. So if that means surgery, we gotta lop off that extra toe, then that's what we gotta do. Now, just like people can develop narcolepsy, so can dogs. I have a whole video on everything related to dog sleep, but this is one thing I forgot to talk about in that video. Canine narcolepsy is a condition that affects the dog's sleep cycle and causes them to suddenly wake up or actually go into full paralysis. They also can experience sudden and brief episodes of just randomly falling asleep, usually after any kind of excitement, any kind of play, anything that gets them worked up. They can instantly just fall asleep. Now, one of the trademark symptoms of a dog with canine narcolepsy is something called cataplexy. Cataplexy is where the dog's muscles become weak or even paralyzed while they're awake. And you'll see your dog that has this completely collapse, but be fully awake but not able to move. It's really scary, actually. Rapid eye movement intrusion is something that many narcoleptic dogs can suffer from. And this is basically where the dog goes into REM sleep while still awake. There are certain breeds that actually have a genetic predisposition for canine narcolepsy. Two of the most popular dogs that suffer from this are Doberman Pinschers and Labrador Retrievers. Now, super important that we get an accurate diagnosis if this is what's going on with our dog. There's no just blanket, super fast fix for canine narcolepsy. It's just a condition the dog's gonna have to live with for their whole life. But there are options and treatments, some medications that the veterinarian can prescribe that can help give the dog a better quality of life. Rabies-induced aggression. It's extremely rare for a dog to bite with no warning sign out of the blue. It almost never happens. The one time it does, though, is when there is an actual medical issue that causes this behavior. And rabies actually is the #1 reason for dogs biting out of nowhere. So first we got to understand rabies, okay? Rabies is a virus and it is all over the globe. There's almost nowhere in the world where there's no rabies. Every year, almost 1 million animals die from it still, and even people it affects. Nearly 60,000 people a year are still dying from rabies. So it is a very serious issue. So rabies is a viral disease caused by a virus, and it can affect all mammals, us humans and dogs. One of the hallmark symptoms of a dog with rabies is unprovoked, highly vicious aggression. It can be towards anything, towards people, towards other animals, towards even inanimate objects. A dog with rabies, you think you've seen an aggressive dog? You have not seen an aggressive dog until you've seen a dog that is infected with rabies. While rabies is most commonly affected with aggressive behavior, there's many other neurological and just behavioral conditions that dogs can show when they're infected with it. Fever, paralysis, disorientation, excessive salivation. There is such a dramatic change in a dog's demeanor and behavior. It is hard to process that actually that's the same dog that you used to know. On top of that very vicious aggression, another interesting thing is the way dogs with rabies use vocalization. They'll start growling, start snarling, much more, and again, unprovoked, at things essentially for no reason. An even crazier thing then is dogs develop hydrophobia. The rabies virus affects the muscles in the dog's throat, which actually can make it hard to swallow. So then what happens is the dog starts to avoid water or try to avoid swallowing their own saliva because they're afraid they're not going to be able to get it down. They're going to choke. Now, sadly, when dogs get rabies, 99% of the time it's fatal. Once the dog has rabies, starts showing symptoms, they're usually dead within days to weeks. And us humans, we have to be very careful when we're dealing with an animal that is rabid or potentially rabid, because the rabies virus is zoonotic, which means it can be transmitted from animals to us humans. So we have to be extremely careful when dealing with an animal, whether it's a dog or any other animal, that potentially could have rabies. Now, fortunately, we have a rabies vaccine, and this is why it's so important you keep them updated on the rabies shots and the rabies vaccinations, because this is how we're going to prevent our dogs from ever getting rabies and from dying from it. It's extremely rare. I'm almost never is there a situation where you have to euthanize a dog due to behavioral problems, but oftentimes euthanasia is the best option for keeping the dog comfortable. You know, they are suffering when they have rabies and keeping everybody safe around them. If your dog's coordination ever seems off or they're kind of wobbling weird, it could be something called canine vestibular syndrome. This is a condition associated with dysfunction in the inner ear of the dog. And that inner ear plays a very crucial part for dogs with being able to maintain balance and spatial orientation. Usually when dogs develop this, it's a sudden onset. You'll see the dog start to wobble when they're walking, their balance will seem off. You'll also notice that they'll do a lot of head tilting as well. Now, even though this is a condition that develops from the dog's ears, right? One of the symptoms is actually affects the dog's eyes, and it's something called nystagmus, where the dog's eyes are kind of moving really weird. There's all sorts of causes for why dogs would develop this. Sometimes it can be based on an ear infection, sometimes it's something super serious like a brain tumor. Sometimes it can be something as simple as just a side effect to a medication. Now, vestibular disease can actually be very similar when you look at a dog that has it to a dog that's having a stroke. So it's important that we rule out which one is it, because when dogs are having strokes, oftentimes that can go fatal very quickly, whereas vestibular disease, usually the dog can recover. To find out if this is actually what's affecting the dog, we need to do diagnostic tests. The vet will probably do some imaging, do some blood work to rule out what's actually going on. And then from there, it's just about supportive care. And treatment is trying to make the dog comfortable while their body recovers. Most dogs usually recover within a few days to a few weeks, and a lot of them will go back to completely normal. Some, however, will kind of have lingering symptoms, and one of the most common ones is they'll almost have kind of a permanent head tilt. Overall, though, prognosis for dogs with this syndrome is quite good. Ocular proptosis is a medical emergency, and it's where one or both of the eyeballs actually extends out of the dog's eyeball sockets. It's a condition that comes on rapidly, and when it does, it is severe. We do not wait around. We do not wait and see if the dog gets better. You go to the vet right away. Otherwise, you risk your dog going potentially blind forever. The most common thing that causes this is usually like actual blunt trauma, whether it's a fight with a dog, falling off something, the dog runs into a wall, runs into a glass door. Usually some kind of trauma is what causes the eyes to pop out. Dogs with flat faces or short noses, pugs, Boston Terriers, Bulldogs, they have much shallower eye sockets. So they are actually the breeds that are much more prone to this condition. Ocular proptosis can lead to corneal damage, ulcers, secondary infections, and if it's not treated, actually the loss of the dog's eyeball. The way that this is then fixed and treated is usually with some kind of medication, some lubricant to get the eye back in, and if it's super extreme, they have to do surgery. The prognosis on how well the dog's eyes heal then all depends on the severity of how bad it actually was, how long the eye was out, how fast did you get him to the vet. Now, many dogs can make a full recovery from this, but that's assuming you get to the vet right away. The sooner you get this treated, the better the outcome is going to be that your dog is going to recover. All right, guys, that's all for today. Hope you enjoyed this video. And if you did, leave a like, subscribe to the channel, and hit that bell so you get notifications when I put out more videos. And if you ever want a little personal help training your dog from me, check out my website, brightdog.com. See you next time.